I'm going to present a study whose aim is to investigate the differential neuropsychological profiles of ALS patients with and without C9orf72 mutation. The study population includes 741 ALS patients that underwent both cognitive behavioral and genetic testing at the Turin ALS Expert Center in the period between 2010 and 2018. Patients were compared at the same degree of cognitive and behavioral deficit, according to the revised ALS-FTD consensus criteria, and at the same level of motor impairment, according to the King's staging system. Among cognitively normal patients, ALS C9 had significantly lower scores than ALS without mutation in tests exploring executive functions and verbal memory. Among patients with intermediate cognitive impairment, ALS C9 patients had significantly lower scores in tests exploring executive functions, attention working memory, and verbal memory. ALS C9 patients more frequently showed at least one test under the normative cutoff in all domains across King's stages. However, this difference was significant only for the executive functions, visual memory, and verbal memory at King's stage 1, for visual memory and verbal memory at King's stage 2, and for executive functions, verbal memory, fluid intelligence, attention working memory, and cognitive flexibility at King's stage 3. ALS C9 patients who were classified as cognitively normal had significantly poorer performances compared to controls in tests assessing several domains, including executive functions, attention working memory, verbal memory, visual memory, and visual constructive abilities. Overall, the feature that mostly differentiates ALS C9 and ALS without mutation across different degrees of cognitive behavioral impairment is the worse performance of ALS C9 at verbal memory tasks associated to a more severe impairment in tests exploring executive functions and visual memory. When considering the clinical perspective, we found that ALS C9 patients showed significantly lower scores compared to ALS without mutation at King's stage 1 and 3 in tests assessing most of the considered domains, whereas at King's stage 2, ALS C9 patients were more affected only for the verbal memory domain. We can conclude that ALS C9 patients show worse performances at several neuropsychological domains compared to ALS without mutation, already at a cognitively normal level and initial clinical King staging. Thanks for your attention.